I've had a lot of success with people who they might wear a shirt underneath to remind themselves that, I guess they would call it like a guild sigil or whatnot, and that they would go out into the community and they might strike up a conversation with a complete stranger the exact same way they would have done it were they in their character's shoes. And we start kind of creating this parallel process. How do we get the achievement that you feel in this video game world in the real world, be it social, be it academic, be it occupational? And it tends to be a great segue. Sometimes they don't want to give it up entirely. They just want to spend more time getting that meaningful experience from actual human interaction.
Welcome to another episode of Mental Health in the Age of the Metaverse. I'm your host, Christian Ulstrup. My guest today is Dr. Edward Perin. Dr. Perin is a clinical psychologist and Army veteran with a private practice in Ohio. His research interests are in military mental health, post-traumatic growth, and whole health models of wellness. He's also pretty great on Twitter, which is how we connected in the first place. Check out the show notes to start following him. Dr. Perin, welcome to the podcast.
Thank you for inviting me. I admit I'm a little intimidated following, Dr. Sherry Bauman with her experience and esteem, but I will do my best to give your program justice.
Shout out to Sherry. So whole health and wellness, this is something we were talking a little bit before I hit record. This is an interest of yours. What does it mean?
If we look at pretty much the history of mental health, even going back kind of as far as it goes, we look at kind of this disease model, what makes people sick. It's really just been, I think, within the last 20 years that we've been heavily focusing on, what makes people well, what makes people thrive and look back at their life and say like, yeah, that was meaningful, that was successful, and that was well lived. And I like to take from that research and try to implement that at least to some degree behaviorally with people to help them kind of achieve that meaningful, valuable life.
And how is that different than the standard model?
Well, when you get down to it, we have our Diagnostic Statistical Manual of Mental Disorders, which is, these are all the diagnoses and ways that one can experience pain in the world. And some of them are biological, some of them are organic, and some of them are experiential or based off of life experience. And a lot of them are how they intersect and interact. And in my experience, I found that that's really only useful for a starting point. Like, okay, this is where we are now. What next? I don't really see a lot of clients who say, well, I want that to go away. They say, I want I want more good things in my life. I want more enjoyable things in my life, or I want to have more meaningful social relationships in my life. And we have to figure out, okay, how do we build those? What are the steps that we take? And I find that there's usually a certain point in the work where the diagnosis stops really mattering. At what point, and I'm guessing at what point are we just pathologizing human experience?
You can't escape the whole person. You're never just treating depression.
Right.
Well, that's probably a good segue into the tweet that originally caught my eye. I think there's a lot that we could talk about here. Talking about men's mental health. Unfortunately, over the last few weeks and now for many years, there have been a lot of these atrocious acts of violence, including most recently in Texas and in New York. And you shared a message saying, I want to talk more about men and boys issues after the shooting.
A lot of times when I have tried to raise awareness of issues that I think mostly affect men or boys, or impact them more commonly than other gender groups, I come under attack, or I guess a lot more spicy takes, as if that in order to help one demographic, we are harming another's. And before I know it, I spend my time kind of defending that it isn't a competition. Then I do actually saying, no, boys still need help. We need these are the specific things that disproportionately affect boys and men at least in the American culture. And I mean, that went back even in training in graduate school when I gave a presentation on men and boys issues. I received some quite unpleasant emails from colleagues even before the presentation itself. And I don't like that gets in the way of helping boys and even adult men getting the care that they need. Because in many ways, I think that puts people off from seeking psychotherapy. In many ways, it makes them feel as if those in the mental health community are not compassionate or caring to them, and maybe they're differing worldviews.
Mm-hmm. Yeah, that makes sense. And I think too, at the end of the day, like we're all better off when all groups are, doing better, right? So there's no zero sum aspect to this, right?
Oh yeah, I'm all about coalitions. I think everyone, all genders can work better in harmony if all gender specific issues are given weight and addressed appropriately.
And so, what are some of those issues, men and boys issues, that you think need more attention?
Well, I think the most near and dear to my heart is suicide. Unfortunately, just being male is a risk factor of suicide. We are, at least three times more likely to commit suicide. And it's not just, specifically, my interest comes from military mental health, where it's an additional risk with military service. But this is something that is pretty common from boys to adult men, regardless of military status. Also, we get a lot of education difficulties. Boys are harmed or at least neglected in education. They're graduating at a much lower rate than women. They are going to college at a much lower rate. They're finishing college at a much lower rate. And they are also given a majority of the disruptive behavior based diagnoses, ADHD, conduct disorder, oppositional defiant disorder, which is disproportionately given to young boys who just don't necessarily fit in the traditional American education system, which, in my opinion, many of them go on to be very successful in alternative education systems, things with maybe smaller classroom sizes, more one-to-one interaction, or even being able to do more outdoor active learning with their hands environments. You start noticing their grades going up significantly, their passion to learn going up significantly, as opposed to them being told there's something wrong with you. You have this disorder, if that makes sense.
So it sounds like some of it's, when it comes to maybe natural behaviors, it's pathologized when in fact it's a lack of fit, with the environment.
Yes, absolutely. I think that a lot of it is kind of expected, throughout history. Boys reach a certain age and they want to be active, and now we're in the era of video games and internet and everything like that. If you gave a 10-year-old boy a choice to pay attention for 6+ hours in a classroom or play video games all day, that would be a no-brainer for them. And they'd say, yeah, I'm going to play video games all day.
Mm-hmm. And do you think that technology, video games, that's played a causal role in some of the uptick in mental health issues among boys and men?
Potentially. I think it depends on, not all media is equal. I think there are a lot of media that kind of capitalize on that for educational purposes. I'm a huge fan of the Khan Academy. I don't know if you're familiar with this. It's a great learning tool for children. It teaches math, it teaches civics, it teaches humanities, but it's very interactive. It's very, it uses a lot of bright colors, things that capture our attention, things that make us focus a little bit longer. But it since it's the most stimulating thing in our environment, we can become glued to it. So we use that as a tool for learning. Also, a lot of video games that are cooperative, that require like social communication, boundaries, and just other forms of cooperative play. It can, in many ways, help. Unfortunately, I think there's not a lot of oversight, and people will say, all technology is the same. Every hour of screen time is the same as any other hour of screen time. And that may not be the case if they're being exposed to media that isn't inspiring them, teaching them, or sharing with them positive, helpful civic values.
Right. It's about sort of the quality of the content, not just the quantity.
Right.
And before I hit record, we were you had mentioned that you had actually used video games for a while now to help your clients. Could you share some more about that?
Oh, yes. So I was inspired by one of my mentors, Dr. Patrick O'Connor, who was very passionate about using pop culture and geek media to facilitate change. And he's inspired me to be very creative with that, from bringing comic books into a class, into the therapy room. Because, say it's an adolescent who has anger difficulties and they come in and they don't want to be in therapy. And we say, okay, we're just going to be reading The Incredible Hulk today. It's like, what? We're just going to be reading comic books? Yeah, we don't have to talk about anything until you want to, and we'll just read comic books today. But the content of the comic books will be somewhat catered or geared towards some of the presenting problems. So as they're reading it, they go, yeah, I can really identify that. When I get angry, it feels like I turn into this giant monster and I just smash things. And then it gets the ball rolling for conversation. Video games specifically for young boys, those who might be diagnosed with ADHD, they may have that executive functioning difficulty. So delayed gratification is very hard for them. I used to pull an old Nintendo 64 console into the therapy room and play a game called, Controller Up, Controller Down with Mario Kart. I don't know, for people who may not be familiar with Mario Kart 64, they had this concept they called rubber band, where if you were in first place, you were driving the slowest. If you were in last place, you were driving the fastest. So on the easiest difficulties, it's so easy to get back into first place. But for the kids and their subjective experience, if they're in first place and they're winning and they're having fun, and I tell them to put the controller down, you get to see them kind of tense up and they feel that distress as all the cars start passing them. And, I'll have a stopwatch and I'll say controller up again. And they do easily get to go back into first place. So they don't get to really experience, getting distraught for losing, but they get to practice, what do you do with that energy that you feel? How do you tolerate that? If siblings come in, especially if there's a younger sibling, being able to pass the controller with a younger sibling, you can see the older one go, oh no, I'm losing my place. But it starts a conversation, and it helps kind of teach some of these really important life skills that we can apply, once we become working adults and we have to manage our own time. Unfortunately, I don't think a lot of adolescent boys are taught emotional regulation or even being able to label their emotions. So being able to bring pop culture or video games into the room, I think can really facilitate some of those tougher conversations.
I love that. The controller up, controller down. That's you're really putting it to the test. That is not easy. Just remembering playing N64 when I was growing up.
Right.
You mentioned World of Warcraft as well. Can you tell me about how you use World of Warcraft with clients?
So World of Warcraft, I think, is the most recognizable of these massively multiplayer online games. But there are a million of them. I think Second Life was popular. EverQuest was a common one at the time. But these were usually young men, sometimes, in their 20s, sometimes in their 30s or higher, where they spent a great deal of their time in these online worlds where they get to be heroic. They get to, they always get to be around their friends who are also heroes, and they can put on really cool armor and do all these great feats and go on adventures. And what ends up happening is their living world, their reality world starts getting smaller and smaller and smaller, to the point where they do feel isolated and disconnected. So I like to, they come in and, maybe they've had things thrown around at them like video game addiction, where I would then say, okay, well, what does it serve? What do you get from it? Sometimes they get to talk about how, this is where I get to spend my time with my friends, or I get to be, I get to accomplish goals. I get to achieve things. And we start developing a plan. So, okay, how do we get that into the real life? I've had a lot of success with people who they might wear a shirt underneath to remind themselves that, I guess they would call it like a guild sigil or whatnot, and that they would go out into the community and they might strike up a conversation with a complete stranger the exact same way they would have done it were they in their character's shoes. And we start kind of creating this parallel process. How do we get the achievement that you feel in this video game world in the real world, be it social, be it academic, be it occupational? And it tends to be a great segue. Sometimes they don't want to give it up entirely. They just want to spend more time getting that meaningful experience from actual human interaction.
And so you figure out a way to kind of meet them where they are and then help them take those incremental steps back to reality.
Absolutely. And very often I don't have to teach them anything. They have the skills. They've learned it and they've developed it in this online world. They just have a hard time believing that they can do the exact same thing. Well, I mean, it's harder to fight dragons with swords and magic in real life, but there are appropriate parallels to, conquering goals and, achieving and doing hard things, essentially.
Absolutely. Now, we have a lot of parents in our audience who listen to this podcast. And I'm guessing right now somebody's listening to this going, that is my kid. He's in Fortnite. He's in, whatever the latest multiplayer online game is. And he gets, something thrilling. He's got friends who he connects with on Xbox Live or whatever else. But I'm really concerned that his, reality sphere is getting smaller. I don't know what to do. What is a good first step for a parent in that kind of situation to take?
Well, I might give you two answers, because I think the most important first step is please observe what games your kids are playing. I know the child in me hates that I'm saying this, but be aware of the content that your children are consuming. Not all of it is pro-social, cooperative, and playful. Sometimes it can be the content of it can be very maybe not maybe at a level of maturity you don't want them to be experiencing, but you just don't know it because you're not spending a lot of time with them. But secondly, I think that kind of going back to one of my earlier comments, that not all media is equal. There's a lot of positive research in the video game world about both cooperative, competitive play, where you're on maybe a headset communicating with friends, and you are playing together, competing against other people who are on a headset. That's actually developing some of the same higher or second order social skills that organized sports do. Now, it may not give the additional physical benefits of exercise, but in many ways it is helping them. They are growing, and they are in many ways learning very important lessons in how to do teamwork and how to achieve great things later. But it is important, though, that you're very aware of what they're doing, and a parent should put some limitations on what they play, not just, time spent in that world, but also, what is the content that you're consuming in these video games.
So it sounds like, like you said before, not all content is the same, not all screen time is the same, certainly. And, best case scenario, you could start developing some of these skills, whether it's, how to work on a team. This brings to mind when I was, I think 15 or 16, I started playing Battlefield 2. I don't know if that rings a bell, but the Battlefield series was super fun. I would play with my uncle and some of my friends. And I think that was probably the first time in my life that I had to start thinking about like management and strategy and how to, assign tasks and all that kind of stuff. So there definitely can be benefits. But I hear you that there are also probably games and content that should generally be avoided. Do you have a heuristic or a rule of thumb for parents as far as, what should be off limits or restricted versus what can be helpful?
I don't. I just encourage parents to be there with the kid while they're consuming that content. And a great example of this comes from, I think, the success of Grand Theft Auto 5. I found out a lot of, I was working with some middle schoolers at the time, and I found out a great many of them were playing Grand Theft Auto 5. And while it's not my place to say, that has a lot of mature content that you probably don't want your child interacting with, I do say that, be present with them. So as you observe them being exposed to it, you get to choose what conversations you have about it. Even if it's something is like, that that's not okay. That you don't actually run over police officers, old ladies, or et cetera, et cetera, et cetera. And I did find that most of them, after spending about 10 minutes watching their child play, that child doesn't play Grand Theft Auto 5 anymore. But I do think that it's more about the parent being present, the parent being aware, and the parent being willing and open to have those tough conversations if they're consuming violent or sexually explicit content.
All right. So don't put your head in the sand, basically.
Exactly. Absolutely. That's the risk, because the children will make up their own rules about what that means if you're not there to help them.
Right. That makes sense. Unfortunately, everybody, when you're growing up, you do have that friend whose parents are not paying attention. So you will get exposed to some of that content at some point. And then the question becomes, how do you handle that? And that's based on really the rules and the boundaries that you set with your parents. Right.
Absolutely. The mandate, thou shalt not play, to a kid, that means, okay, well, where else will I play it?
Right.
I'm myself guilty. I think it was back in the Street Fighter or Mortal Kombat days. I was banned from playing those games, so I went to the friend down the street, and I still got to play it.
Yep. No, it's a very, very familiar story for sure. Cool. Well, so I want to switch gears for a second. You had another tweet. I think this is one of your more popular ones that I would love to unpack a little bit.
Okay.
You said last year, quote, "Every act of discipline enhances self-esteem." Help me understand that a little bit.
Yeah. So I want to give credit to my stepmother for that. That was her mantra that she shared with me. I like it because it does have a nice cadence to it, and it does flow. But I think it is important because, at least in psychotherapy, one of the distinctions we make is between reacting and responding. And very often we talk about how being reacting or reactive, we engage kind of our default settings, almost our stereotyped behaviors, as opposed to being able to take a step back and go, okay, what is my goal in this moment? What am I aiming to achieve? What is my intention? What am I paying attention to? How do I want to approach this? And that often does come from leaning back on one's value systems. If we are reacting and our reaction is not really aligned with our value systems or the kind of person that we want to be, we tend to kind of swallow that, or we tend to kind of embody that, because now it's not just, hey, this bad thing is happening, but now I might be bad for not doing it the way I want to. So I do find that discipline, in its extreme, can also be a little dangerous, especially when we get into the realm of addiction. Some might know people who are maybe they're still addicts, even though they haven't used their substance of choice in years and years and years, because they're going through life sort of white knuckling it, just kind of bearing down and getting through, as opposed to making sure that they are living a life more aligned with their values, the value system, and who they want to be. So I do think that when we do respond, and we respond, maybe not, we don't always solve the issue, right? But we act with integrity, or we act with, we're able to defend our decision and say, yeah, even though it didn't work out, I'm glad I did it this way. I do to this day strongly believe that builds self-esteem. I don't think that the outcome of healing is always happiness. I think the outcome of healing is integrity, knowing that this is my thoughts, my actions, and sort of my goals are all in alignment with each other.
And I think, unfortunately, that kind of thinking is largely lacking, probably in 2022. And that's been a trend for a long time. Something I've heard from parents and some of the kids in our program is a lot of them feel very confused, I would say, generally, about what is true, what to value, what the future could look like. And that makes it very difficult to figure out what your values are and what that ideal is that you can aim for in the first place. And so, to that end, for anyone listening, whether it's a parent or maybe a young person who doesn't have a good sense of what their values even are, how can they kickstart the process of figuring that out?
Besides engaging a therapist, well, I'm a huge supporter of I guess we call it mindfulness now, and it's become quite a pop psychology term.
Yeah.
But this idea of being able to take the view of yourself from 10,000 feet, not just, hey, I am reacting this way, but why am I reacting this way? I believe that our pain and our values are two sides of the same coin. Where we hurt is usually because something is being unmet, something is being blocked, or something is being taken from us. And a lot of times we can kind of get bogged down on maybe trying to describe their hurt without really giving enough attention to why does that hurt me? What value is this pushing against? Or what value is not being met in this moment? And so I guess if I were to oversimplify a starting point, I think it would be look to where you're hurting. Where do you feel pain? You're likely going to find your values are underneath that.
Interesting. I would imagine, I'm speculating a little bit, but when, your phone or some short-term reactive source of relief is kind of always at hand, that can be very difficult because you have to create a little bit of space and, have the fortitude to go through it. Any recommendations as far as cultivating more mindfulness or digging into some of those feelings?
Unfortunately, I don't think there's a shortcut to it. If you were to imagine that these were like muscles, these mental muscles, it comes from practice, and it doesn't mean that you could do it wrong or that you're maybe not doing it enough. But the more you look into it, I think the easier it gets to go through that process as more things come up.
Makes sense.
I don't know if that answered your question.
Work out the muscle. Yeah.
Right. And you can't just start at the beginning by lifting the heaviest weights, right? Your first day at the gym, you're not going to be trying to, deadlift 400 pounds. You got to start with lower weights, build up the repetitions, put weight on over time. And you just continue to get better at it.
Great advice. Start small, but put in the work.
Yeah. Right. Exactly.
So we've talked about a few different topics that probably deserve some more attention. You're on the front lines in what is increasingly being referred to as the mental health crisis. Anything else that you think should be discussed more?
Well, one of the things that I'm noticing that is concerning me, I think, is an identification with a diagnosis. I think everybody knows somebody who might playfully play off like, oh yeah, I have to keep a nice home. I'm so OCD. Ha 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 ha. Or it's like, oh yeah, I'm having these mood swings. I'm so bipolar. Ha 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 ha. ADHD, I think, is one of the most overdiagnosed conditions, especially in youth. I don't agree that everybody diagnosed with it may actually have that disorder, but think about all the wide variety of diagnoses that are out there, whether they've been self-applied or maybe they got it from Dr. Google or WebMD, as opposed to a formal diagnosis that will even say things like, oh, I am ADHD, or I am bipolar, or I am autistic. That's an identity state, as opposed to I have ADHD, or depression is present. My anxiety is high today. I caution people about identifying with a diagnosis, because that's not an identity. That's just a cluster of symptoms that, some may be organic, some may be not, but they aren't the whole or the totality of your being. Unfortunately, I think there are some groups that idolize or almost fetishize having a mental illness diagnosis. And I think that that's not just unhelpful for them, but it's stigmatizing for the individuals that do suffer from some of these very debilitating illnesses.
Do you think social media has played a role in this trend?
I mean, I don't think it's helping that much. No, I think the desire for likes, the desire for interaction, the desire for increasing that friends list or follow list, whatever it may be, it we, I mean, human beings, we learn through trial and error, and if we do use certain content or use certain language, like a diagnosis that gets a lot of positive feedback. For some people, that might be the only content that they get interaction on, or the only content that they get the positive reinforcement from their peers. So, like as anyone would do, they learn from this and they will do that more. And sometimes that might be steering them towards an unhealthy lifestyle or unhealthy social engagements, because it's not really teaching how to have authentic, open, and honest friendships. It's about really keeping things superficial or on the periphery. And a lot of people who do go down that road will report to me that they don't feel like they have a lot of strong, sincere, close social relationships. And very often that's the start of the work.
This is something that I really worry about a lot. I mean, this is a big part of the reason why we founded the company is the technology that enables a lot of these sort of superficial experiences, a lot of these literally virtual simulated experiences, whether it's connection or achievement, you're out slaying the dragon, whatever it is, they are becoming more compelling, accessible. The screens have literally been approaching our faces until you can just strap it on now. And
Right.
I think in many ways we kind of already live in the metaverse. You and I, of course, are having a remote conversation, which it's not all bad. But I am concerned that the technology is getting so good that it could be very difficult for a lot of people to come back to reality if they feel like they're getting these compelling experiences and feedback loops closed and everything in the virtual world. So in 2022 and maybe going into like 2030, what do you think the case is for reality? Why should we continue to prioritize reality over these virtual experiences?
Well, unfortunately, virtual experiences can't nourish our bodies. First and foremost, kind of as I started my interest in wellness psychology, we asked, what makes people healthy. Well, one of the key components of it is movement, social connection, sunlight, diet, exercise. Some technologies, I know virtual reality is really growing and being able to provide, movement, exercise, social interaction, things of that nature. But we don't always feel fulfilled in all of these areas of our life. And unfortunately, we live in a society, we live in a community. We need to be able to take our headsets off, put our controllers down. Our neighbors sometimes need our help. Our community members sometimes suffer, and we need to know that they can lean on us just as we can lean on them. And I think a truly open global metaverse, as terrific as it is not an alternative to a local community or being part of a local community that you can reach out and touch.
I totally agree. Team reality.
Team reality.
Although I am concerned that this would be a growing issue, and certainly for a lot of kids and teens who are concerned about the future or don't feel particularly fulfilled in the real world, this can be an easy place to escape. So, final question. I always like to ask for some practical tips for parents. Let's say you have a 12-year-old boy who is, spending all this time in virtual worlds. What can you do to really help him get excited about reality?
Well, so I work with a lot of dads, and I think this comes up a lot. because some of these dads will tell me, I don't want to just be a sperm donor, right? I want to be a good dad. How do I be a good dad? And, some of I give a lot of credit to them. Sometimes they work very long, hard days and they come home and the only thing they want to do is maybe put some hot food in their belly and get some rest. But that's when their kid's coming up to them to want to throw the ball around or want to do, or maybe play video games with dad. So I think the most important thing to do is to be connected with them. Even if it's in play, to just to spend time with them, to first model. And I think this is where a lot of people start missing the mark, is that you got to model what going out into the community. You have to model how to have very adult or very healthy adult relationships. You have to model how to resolve conflict in adult relationships. Let them see you solve problems with your friends and encourage them to do the same. Once they have observed you doing it, start doing it with them. Start connecting with, other parents with kids. Make sure that it's very parallel and active, things that you're doing together. And kids not just learn from their parents, they want to emulate them. So the first step, do it, show them, do it for them. The second step, do it with them. Well, the third one is when they start repeating your behaviors, when they start trying out, how to be like dad or how to be like mom, you're going to see it even in small little doses. You need to appreciate that. Show them appreciation for doing it on their own. I think a lot of parents tend to skip that step. They say, I'm going to tell you what you need to do, now go and do it. And I think the first step is, give them a model for what it looks like, but also start there's no way to overpraise a kid when they do what you want them to do. If they say, yeah, I'm going to go to the playground and just, swing on the monkey bars for a while. Whoop it up, high five them, say, yes, I'm proud of you. Go do it. I'll come with you, or we'll get ice cream afterwards. Whatever you want to do, just overpraise them. Let them know that that's something that is good for them, by just really acknowledging it. Gosh, I hope that answers your question.
It does. I'm laughing in part because I think that's what my wife uses on me. She gets a little too excited when I take the trash out or, feed the dogs or do the laundry.
Does it work?
It absolutely works. I think it's a fantastic piece of advice. So, perhaps I think the impulse with a lot of parents around this is to really focus on what the kid is doing. But it sounds like the three steps that may be more effective are, one, to ask, how are my habits? What am I doing? So it's, modeling. Yeah. Two is collaborating. So how do you sort of meet the kid where they are? And then three, closing the feedback loop so they get that reward when they're on the right path.
Absolutely. And not to rush through step two. That's the opportunity for fine tuning. This is what you're doing right. This is where you could do better. And here's another thing you're doing well.
Awesome. Cool. Well, I think that's a fantastic place to close the conversation. Dr. Perin, I really enjoyed this. You're on Twitter, of course. What is your handle so people can follow and connect with you?
So my handle is my name. That's Perin Behavioral, Perin Behavioral. It's the same as my website.
Fantastic. We'll put that in the show notes. And that's perinbehavioral.com. So if you're looking for a psychologist in the state of Ohio, but soon, I think 30 states across the country with PsyPact, is that right?
Oh, yes. So PsyPact is growing. PsyPact is really an awesome interjurisdictional license for online psychotherapy. I have not opened up slots outside of the great state of Ohio yet, but it will be available soon. So if you are looking for a therapist and you think that I could, or your values align a little bit with mine, feel free to shoot me a message.
Sounds great. I'll put that in the show notes. Dr. Perin, thanks for coming on. Have you back soon.
Yeah, thanks for having me.